Hi, so my name is Tom Turmezei, and I'm a consultant musculoskeletal radiologist working in Norwich in the United Kingdom, where I'm involved with in a range of diagnostic and interventional services, all focused on musculoskeletal medicine. Now, I'm also the imaging research lead, where we oversee approximately 150 different research trials, some from sponsors, some from our academic partners. Academically, I'm also an imaging researcher. I have a position at the University of East Anglia as an honorary associate professor, and also as a visiting researcher at the Metabolic Bone Unit at the University of Cambridge, where I did my PhD that finished a few years ago that was in 3D imaging analysis, looking specifically at CT in the context of osteoarthritis. At that stage, that was mostly at the hip, but this has extended to be in research with weight-bearing CT at the knee and ankle. I've been using weight-bearing CT imaging for a few years now, and this started off at the knee in collaboration with Neil Segal in the United States, working on some data that he has acquired, but also now moving into data acquired with the multi-center osteoarthritis study. This has involved applying 3D imaging analysis techniques that I've been developing in collaboration with engineers and rheumatologists in Cambridge. And what we've been doing is focusing on trying to map out the joint space width in 3D, and critically, the weight-bearing technology that weight-bearing CT affords means that we can do this in realistic loaded positioning and also look at the joint space as a whole 3D map rather than some unidimensional reduction of joint space width measurement. We can also do other things such as look at the bone thickness and density and also the bone shape. So doing things like statistical shape modeling as well to look at how all these factors relate to trying to predict current and future disease states for individuals with osteoarthritis. Now, I've also done some work with the early adopters of weight-bearing CT technology at the Royal National Orthopaedic Hospital in Stanmore, led by Matt Welk, where we've looked at the repeatability and reliability of weight-bearing CT at the foot and ankle by examining multiple joints at the ankle and hindfoot. But importantly, clinically, I also use weight-bearing CT technology when I was at Stanmore. We did have a machine there for looking at the hindfoot disorders and preoperative planning. That was about 5 years ago when I was a fellow there. And now in Norwich, the consultant orthopedic staff have been engaged by weight-bearing CT and the potential, not just at the foot and ankle, but also at the knee and higher up in the lower limb. And we are actively pursuing the opportunity to have that technology with us here in Norwich. So it's an absolute pleasure to be asked to join the board of the International Weight-Bearing CT Society as the radiology representative, which I'm really looking forward to working with the society in order to make weight-bearing CT a technology that is more widely accepted and understood, not just in the orthopedic surgical community, but also in the radiology community. I really want to push weight-bearing CT to its full potential. And I want to do that also in combination with my research and clinical roles. Another research role that I have is as the chair for the executive committee of CT and osteoarthritis research, which is an international group of interested members that want to promote the use of CT and osteoarthritis imaging research. So there's lots of crossover to explore there. I do think this is a really important initiative and that the two societies, the two groups come together, and we do this on an international scale so that we take advantage of the international network of researchers and clinicians that are already using this, and we can give it a platform in order to push our research, presenting our research and publishing our research at conferences and at society meetings so that we can raise profile of its use and its potential impact. And of course, that research is going to have to establish the clinical and predictive validity of how we want to use weight-bearing CT in the lower limb. I also think it's really important that we push the roles of and the potential of weight-bearing CT at the lower limb by forging strong links with our industry partners that are developing this technology and the software that accompanies it, because they have the experience, they know the market, and they will help us reach out to clinicians that are interested to help serve the best needs of patients with this kind of 3D imaging technology that we think has the capability to replace radiographic assessment, both in the clinical and research setting. And in that research setting, it's also vital that we have ongoing discussions with regulators of clinical trials. So, for example, the FDA, in order to be able to CT and specifically weight-bearing CT technology at the forefront of imaging assessment in research clinical trials, that we can then end up translating with useful clinical and predictive validity into the clinic. So from a personal perspective, I'm really looking forward to pushing forwards with my 3D imaging analysis research with my collaborators in Cambridge and in the USA on the multi-center osteoarthritis study imaging data, where we're going to look at bone shape, joint space width, and cortical thickness distribution in 3D. And I think what comes from that research will be exciting to inform the future role of weight-bearing CT at the knee specifically. But part of this collaboration also, as I've said earlier, was involving Octa Research and the International Weight-Bearing CT Society. And I think it's going to be really exciting to kick off a number of joint engagement events that we are hoping to start with as a jointly hosted webinar exploring the role of weight-bearing CT and its potential at the knee that we're aiming to put out there on the 31st of January in 2022, which we're really looking forward to having people from the relevant orthopedic, imaging, and industry communities joining us for that. But specifically, I think it's also going to be really important that we target how we're going to introduce and set the standards for weight-bearing CT at the knee in particular. Now, this will involve how we're going to standardize imaging protocols, whether that be positioning, scan range, do we need to do both sides, one side, exactly how the weight bearing should be done. Because as soon as we can then standardize how we do the imaging, we have reliable imaging output for our analysis. And that analysis also needs to be done with novel software solutions that are shown to be clinically relevant and also embrace cutting-edge technology such as artificial intelligence solutions. And I think working all together and engaging through these future events and bringing together the community around the International Weight-Bearing CT Society and Octa Research and the clinical and research communities at large, along with our industrial partners, we can forge a strong road ahead for the role of weight-bearing CT in the lower limb.